Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Clindamycin. Its brand name is Dalacin. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So clindamycin exerts its antibacterial activity by causing a cessation of protein synthesis. It also causes a reduction in the rate of synthesis of nucleic acids. In terms of indications for use, this medication is indicated to be used in the treatment of infectious diseases of the abdomen. It can be used for severe infections of the skin or subcutaneous tissue. It can be used to treat impetigo or severe lower respiratory tract infections. Clindamycin can be used to treat pelvic inflammatory disease or sepsis, as well as some other indications. Now, before somebody was to use clindamycin, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. So clindamycin would be contraindicated in patients who have a known hypersensitivity to clindamycin or any other component of the product. And this medication would also be contraindicated in newborns, so patients less than 30 days of age. Now, in terms of precautions, it should be noted that if patients experience severe hematologic adverse effects, the dose of the medication should be decreased. Clindamycin should be prescribed cautiously in atopic patients. This medication does not diffuse into cerebrospinal fluid adequately, so it should not be used to treat meningitis. The use of antibiotics can sometimes lead to an overgrowth of non-susceptible organisms, particularly yeasts, so a superinfection may occur with the use of clindamycin. This medication should be prescribed cautiously in patients who have a history of gastrointestinal disease, particularly colitis, as well as inflammatory bowel disease or a history of antibiotic-associated colitis. Clostridium difficile-associated diarrhea has occurred with the use of many different antibiotics, including clindamycin. Severe allergic reactions have been reported with the use of clindamycin, including drug reaction with eosinophilia and systemic symptoms, also known as DRESS, Stevens-Johnson syndrome, and toxic epidermal necrolysis. And lastly, for precautions, it should be noted that clindamycin should not be used by nursing mothers. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use clindamycin, they can expect to receive their dose orally. The recommended dose for adults would be about 150 milligrams every 6 hours. For moderately severe infections, they may increase the dose to 300 milligrams every 6 hours. And for severe infections, patients would typically use 450 milligrams every 6 hours. If a patient misses a dose of clindamycin, they should take their next dose as soon as they remember, unless it's close to the next dose. A dose should never be doubled to make up for a missed dose. As with all medications, there are some side effects or adverse reactions that patients may experience while using clindamycin, so I'll go over some of those here now. Typical adverse effects that patients may experience would be abdominal pain, nausea, or diarrhea. The more rare but serious side effects would be the dermatological effects that we discussed, including DRESS, Stevens-Johnson syndrome, and toxic epidermal necrolysis. Patients may experience Clostridium difficile-associated diarrhea, or Clostridium difficile colitis. Patients may also experience a granulocytosis or an increase in liver function tests. That's all we're going to talk about today with clindamycin. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.